Hey all, welcome back to another episode. I am super excited. Today I have a very special guest. This is actually my own pelvic floor physical therapist. Her name is Kelly. She is so awesome, very easy to get along with. She is a mom, and she's very passionate about, helping especially active moms or any moms just feel better about themselves before, after pregnancy and delivery, working on bringing their pelvic floor back to normal so they don't leak anymore. They don't have, the uncomfort or the lack of confidence in themselves when they're trying to get back into activities or just day-to-day life. So really excited to have her on here and go over a lot of pelvic floor type things. She's going to give some great takeaways and action points and things of that nature. So stay tuned. She is going to be fantastic. All right, guys. So this is my personal PT. This is Miss Kelly. I'm going to let her go ahead and introduce herself a little bit, though, where she's at, where she came from, what made her get into this, job, career, all of those things.
Yeah. Hi. Thanks for having me. I'm Kelly. I'm a physical therapist. I specialize in pelvic floor. I just started my own practice here not too long ago, about 6 months ago, called Strong Her Physical Therapy and Performance in Ankeny. So I started out in PT, kind of the typical realm. I was doing joint replacements and post-op things and like really the whole gamut, kids and neuro, all the things. And it just wasn't lighting a fire in me in any way. So then when I started my career down in Arizona, and then when I moved back to Iowa, I was like, I need something different. And that kind of landed me in the pelvic floor space, which I really love. And also being postpartum myself, going through a pregnancy and trying to navigate as a person who's been fairly athletic my whole life. I like to be active, I like to move. It's like, okay, how do I continue to do that? How do I stay strong in my pregnancy? How do I safely get back to all the things I want to do postpartum? How do I get back to heavy? My thing is CrossFit. So how do I get back to heavy lifting? How do I get back to jumping, hanging from a rig, all those kinds of things? And that's kind of my spin on pelvic floor PT and postpartum recovery and all that kind of stuff is, what do you want to do and how do we get you there? I don't like putting limits on anything. I think the pelvic floor world can be a little bit overwhelming because you're like, what is all this? There's a lot of there's a ton of information out there. I'm always saying, like, the internet is kind of a scary place when you go to start Googling pelvic floor or core things, postpartum, pregnancy. So I like to be a source of like empowerment for people, take away some of the fear and help them figure out how can you get back to any of the things you want to do. So that's kind of what got me into like diving into my own space in the pelvic floor world.
Oh, I love it. And like one of the biggest reasons I wanted to have you on here was obviously because you've helped me already so far, just learning so much about my body. And like I have had improvements already as well, which we've discussed, which is fantastic. And I'm always super open with people like, yes, I pee my pants all the time. I'm like always running to the bathroom. I drink a ton of water, but like it's getting a little ridiculous. And my husband would always joke with me that as soon as like he would tickle me or like whatever, I'd be like, well, there goes that. I better go change my pants. So just a lot of those things really brought me to you. And I feel like there's just not a lot of people like you, physical therapists like you, that specialize so much in this very, I mean, I don't know if a good word, intimate part of someone. And I guess that's something that maybe we should address first. Like, I know when I was with you, I didn't feel awkward one bit, right? Like, yes, there's an exam. Yes, there are things felt because you have to know. But, what's your take on that? How do you, as in your position, help people feel comfortable and walk them through maybe what the process looks like from your end?
Yeah, absolutely. I always say like the biggest thing with pelvic floor, well, and any provider too, I really like to advocate for people like you are the boss of your own care. You 100% are in the driver's seat. Anything you don't want to do, we don't do. Like you get to take control and consent is given throughout and consent can always be taken away. And I like to make sure that's true. Like if at any point you feel uncomfy, we will be done, anything you want to do. So in the pelvic floor space, in all healthcare, I think that's important, but especially in the pelvic floor space, because it's different than, if we're working on your shoulder or working on your low back, it is a little bit different. So I like to, so I guess we can start with in pelvic floor, a lot of times what is, kind of the gold standard of knowing what is actually going on with your pelvic floor muscles is an internal pelvic floor assessment. Um, and so a couple things I always really detail, like this is what I'm looking for, this is what I'm looking at, this is how I do it. This is what to expect. And also just remembering that these are muscles just like anything else. I'm looking at them like these are muscles. I want to know how strong they are. I want to know what their endurances look like. I want to know if they can contract and relax and why that's important and how that gets us to your goals. I always like to tell people, like, when my dad calls me and he's like, I threw my back out, this, and this is going on. I can have a pretty good idea over the phone what's going on, and I can kind of get him started on the right path. But I don't really know unless I can get my hands on him and get my eyes on him. So the same thing in the pelvic floor. I can have a pretty good idea based on the things we talk about, the things I see externally. So if someone's not comfortable with an internal pelvic floor assessment, there are tons of things we can start off with. We can circle back to it later if you're comfortable with it. If not, totally fine. But if it is something you're comfortable with, I do think it just gives a little bit more complete picture. I can double check all the things I'm thinking in my brain and make sure we're setting you up on the right path as far as getting you to your goals.
Yes. And I think that's like the biggest thing that really helped me relax too, because even in the gynecologist's office, like there's nothing comfy about like scoot down to the edge, and God, I hate it. But when you say literally per your words, like I think of it as a muscle, like any other muscle in your body, it helps me relax a little bit more because honestly, that is what it is. It's a muscle and it's responsible for a lot of things. A couple weeks ago, I have a friend that joined us on the podcast, and she went through prolapses and full hysterectomy and all of the things. And she went through like how important it is to find someone like you if you're struggling with these things and how not to be afraid to do it. So I think it's really important for people to understand like this is just a muscle, just like your bicep, just like your back. Like it's a muscle. So yeah, I
Yeah.
think that's great.
I
Oh, go ahead.
I also think, like, oh, sorry, in like all healthcare and especially pelvic floor, your OB, like find someone who fits with you too. Like if you're just not jiving with a person, totally fine. Like if they're not someone you feel comfortable with, totally fine. We all have our people and people we gravitate towards more. So I always want people to know that you get to choose your healthcare provider. If your doctor refers you here for physical therapy and it just like wasn't a great fit, that's not where you have to go. You get to pick, you get to be in charge of your own care. And so find someone that feels good. That I think that's a huge piece of it too.
Oh yeah, I absolutely agree. Like we hit it off the first second I walked in. Like it was so easy to get along with you. And I think that that's really helpful too because you're an active mom too. Like you understand, especially who I am, who a lot of my clients are. Like we want to be able to do the box jump or the deadlift or the squat without peeing ourselves everywhere, right? Um,
Yes.
and I also want to point out, I'm going to put Kelly's website as well as Instagram on here too. But she does all kinds of like reels and really helpful things that you can do as far as movement goes to help you try and learn how to control things a little bit more too. So we're going to put that in there. Um, but something that I always think I thought was super interesting when I started diving into this is it's not always a weak pelvic floor, right? That's what we're so often taught is it's just all weak. You got to do all the Kegels, right? Give me your take on that. Like, what are the different ailments people can struggle with mostly, like the main go-to things that you see?
100%. Yes. When you start Googling pelvic floor, it's like the one and only answer you get is Kegels. And like, it is not, there are people that specialize it. And then there are people that, even before I got into pelvic floor PT myself, like I knew this bit. And as I've dove into it, I'm like, it's this whole world that um, you can't just narrow it down to like one action of the pelvic floor or like one impairment. It'd be like saying, your back is only tight. Like there's so many other things. Like what's your core doing? What are your hips doing? Same thing with your pelvic floor. Um, so there are a few different categories typically we fall into when it comes to pelvic floor. We can have an underactive pelvic floor where we just don't have enough oomph in our squeeze. We don't have enough endurance to maintain that squeeze through what we're doing. So I guess let me backstep a little bit. When we think about leaking, we're thinking about these pelvic floor muscles should line the bottom of your pelvis. They should create closure around your urethra. That way, when you jump, sneeze, laugh, cough, they kind of kink that opening, and you're not losing things when you don't want to be losing things. So one, we can have not enough oomph. We just can't close it enough. That's when maybe Kegels are a thing. Two, we can have an overactive pelvic floor. And I think this is the big thing a lot of people miss is that, all right, we can actually have too tight of a pelvic floor or a pelvic floor doesn't know how to relax. And so I always describe a pelvic floor, it's going to contract and move like an elevator. So when we are just hanging out doing our thing, we should kind of hang out on the first floor. We should have some amount of tension in our pelvis, just like your core. You've got some amount of tension just kind of hanging out doing our thing. When we go to the bathroom, we should be able to completely relax, open, um, lengthen our pelvic floor so that things can come out. And then when we sneeze, laugh, jump, cough, sneeze, I think I said sneeze already. We want to go all the way up to the fourth floor and do a really big, strong contraction so that when we have that downward pressure, our pelvic floor is fighting that with an upward pressure. And that way pressure is equalized and nothing is coming out. If we have an overactive pelvic floor, we're always just hanging out on the third floor and we go to sneeze, laugh, jump, cough, we've got nowhere else to go. We don't have anything left in the tank. So we can't create extra force against that downward pressure. That being one piece. And then two, if we're just constantly squeezing, we're going to fatigue a whole lot faster than if our muscles are just kind of on and off like they should be. Lastly, it could totally just be a coordination piece. Pelvic floor doesn't really know when it's supposed to squeeze. So we have the squeeze, but it doesn't know that when I sneeze, hey, we need to do that. So sometimes it's just like a re-coordinating piece in there too. But then like the last part of this too is our pelvic floor doesn't act in isolation. It's a part of this whole core system. So what is your core doing to help it out? What is your hips doing to help it out? It's not just the pelvic floor, but then we got to throw that in with like the whole system too.
Absolutely. And I know that like something that we discovered, and I did a post about this, and there were so many people are like, oh my God, I had no idea. This is all the things I've been struggling with for so long, and I didn't know it was this. Ab gripping or clenching. I don't know what the technical term is for you, but describe like I want to go through some of the symptoms so that people can understand maybe I'm more weak floor, maybe I'm more tight floor, maybe I'm struggling with ab gripping, or butt clenching, because I know that's kind of the opposite. So if you want to go through those four with like
Yeah,
symptoms, that'd be great.
absolutely. Um, so when it comes to like ab gripping tension, pelvic floor tension, so I always say a lot of times those kind of not always, again, it's not always, but especially as like young, active, busy females, moms, like we're doing all the things all the time. We're always kind of running at a high energy. We're also really used to being athletic. We're used to creating tension. We're not that great at learning how to let it go. And a lot of times we hold that tension, in our lower bellies, in our pelvic floors. I always think somewhere along the way, we were kind of taught to stand up tall and kind of pull our belly in. But I always give the analogy of like, that's kind of if you imagine walking around with your elbow bent halfway all day, like your bicep would get pretty tight and sore, and then it really wouldn't want to lengthen out all the way. So we need to be a lot of, I think, moms learning how, not only moms, but young active females in general, and probably males too. I just tend to work more with females. Learning how to let that go, learning how to I would say just let your belly be what it is. Unless you're picking something really heavy off the floor or you're doing core work, just let your belly be what it is. We don't need to create more tension or brace our core when we're just walking through target. Like we should be able to, again, kind of have this on off versus this constant tension. And I think that's important because, again, not always, but I like to tell people usually what your belly is doing, your pelvic floor is doing too. So if you're always kind of pulling that belly in towards your spine, you're kind of creating more tension in your pelvic floor than it needs to be, and maybe driving towards more of like an overactive state. So I think it's really important that we can keep our belly relaxed so that we can keep our pelvic floor, again, hanging out that first floor instead of hanging out the third floor all day. And that can kind of be the same with butt clenching too. If we're kind of clenching and tucking our butt, we're creating a lot more tension in our pelvic floor than we need to be too. And also kind of just throwing off your alignment. Now our pelvis is kind of tucked under us instead of stacked nicely. But when it comes to knowing like if you tend to be an overactive pelvic floor or an underactive pelvic floor person, there are a couple things that kind of cue me one way or another. So in someone's first session, I ask all the questions. I want to know everything. I want to know how does peeing go? How does pooping go? Do you have any pain with penetration, whether it's tampons, intercourse, what have you? Do you feel like you can empty your bladder completely? Do you have issues with urgency, frequency? All those things kind of help me kind of pair you into a category, and then again, the internal assessment just kind of confirms that. So things that kind of gear me towards more of an overactive state is you're peeing all the time. Like urgency is another thing that kind of tends to be with an overactive. leaking in all the senses, sneeze, laugh, jump, cough. Historically, we think of that more of being an underactive, but that can totally be an overactive thing too. And then any sort of pain. Typically, if we're having pain, penetration, pain with intercourse, pain with tampons, that is also usually a flag for me that we probably have an overactive pelvic floor, or if we feel like we can't completely empty our bladder when we sit down, those kind of things are telling me that we're not getting a full relaxation of our pelvic floor to completely eliminate. And then kind of the flip side of that, if we're having leaking, but we're not having any of those things, sometimes like heaviness or pressure, not always, but will maybe lead me towards maybe we need a little more strength and endurance, because that can be a sign of just pelvic floor fatigue, is that heaviness or pressure feeling will kind of gear me towards maybe we need some more strength.
So helpful. Like literally so helpful. I
But
you were I remember, and this is something that I wanted to just sort of touch on too for those of you, because I know that I was taught from like the age of 8 or 10, like stand up and suck it in, right? Nobody's allowed to see that you're round at any point, right? And it was ingrained. And so when you told me and you like almost gave me permission, as ridiculous as that sounds, to not always require to have a flat stomach. Like I can see four of my abs if I hold myself, right? Like, but then I'm just standing here and I'm like, well, geez, call me panda, you know? And so, but you giving me the permission that it's okay and that's normal and that's healthy, then that just made the biggest difference for me. I had a really honest conversation with my husband who loves me regardless, but I was like, I don't know how to stand without sucking in all the time. And this is a huge thing for me. But within a week, right? I talked to you the following week, my gas that was trapped and painful was gone. I was actually able to pass gas normally, which was a huge improvement. And really the urgency reduced some and it's only gotten better. It's amazing. So I just want to like put that out there. Like, don't be afraid to be honest with like your partner, that hey, you probably don't even notice, but this is something I'm struggling with right now. Right. And I think that's just really helpful to put that out there. So
totally 100%. Because it's hard. It's something that one is like very ingrained in us from a habit standpoint, but then two, there's all that like how you feel about your body and how you feel about how you look, and all those things come and interact with that. So it's not just like, hey, stop sucking in. Like there is so many things we have to fight through, which takes time. And like it's really hard for people to just like reverse engineer everything we've ever told our belly to do.
yeah.
Something I'll tell people is if they're struggling with it, I'm like, do this in the shower. Shut the door. No one can see you. You can just see, you can look at your belly, but no one else is around. You're not worried about how you look, and just see what it feels like to let your belly just be. The other thing I'll tell people is because for some people it's like, I don't even know what you mean. I'd say think about like after you've had those really tight high-waisted jeans on and you finally can unbutton them and unzip them and pull them off, that like whew, feeling where you can just like let your belly go for a little bit. Like that is the feeling I'm trying to get people to just like create on a day-to-day, of just like, hey, my belly is just relaxed, it's soft, it's big, it's round, all those things. And then when we need tension, we turn it on, but then we turn it back off when we don't.
Oh my gosh, it's so so true. And I love that. So I think just like hitting that point home, like you're not supposed to walk around with a totally flat stomach at all points in the day. Most people aren't. It's just not human, right? And so that's why I did like a posed versus relaxed photo the other day as a post. And I had someone say, like, oh, it's just so hard after you have kids. I'm like, no, your body's supposed to look like that. That's not because I had kids. Like, and you can see in the picture before, like, it doesn't look like anything, but then, like, oh, I'm relaxed and there it is. And it's okay. So I think normalizing is a huge piece. Um, I do know from like the little bit that I've researched, but I'd love to hear your take. Obviously, people like you need to kind of tell us what to do to help fix our specific issues. Now, not everybody's local to you. Central Iowa, right? Ames, Des Moines area, Ankeny, perfect. But what about my people that are in like California? What can they do? Like, should they go see someone like you to at least know what they're dealing with? Or what are some key takeaways that maybe they could do to fix one ailment or another? What do you think?
Yeah, absolutely. I always will highly recommend going to see someone, because everyone is different. And like I said, and I tell everyone, like I have a decent idea with what I think is going on just based on the things that we talk about or you tell me. But I'm always surprised sometimes when I check pelvic floor. I'm like, oh, I wasn't expecting that. But that gives me a lot of good information that totally changes how we're going to approach this. So everyone is different. So if you do have the capacity to go see someone in person, and have a plan that's very specific and individualized and tailored to you, your goals, your history, like that is always my number one first recommendation. But if you don't have anyone local, that's the other thing about pelvic floor PT is it's not everywhere, that not a lot of people, not everyone has access to it, which is unfortunate and hopefully improving. But I think just like self-assessing yourself on like, do I feel like I'm a clencher? Am I a fairly like tight person in general? Do I like to hold my tension? Do I get, lots of like neck tension and back tension? That would be maybe something that I think about. Okay, maybe I need to learn how to like breathe through my belly. Can I let these muscles expand? What does it feel like if I try to open my pelvic floor or get it to like move downward? And then can I squeeze and just kind of self-assess, like, can I get my pelvic floor moving in both ways? Um, and then I always tell people, like, when it comes to like pelvic floor rehab, knowing about your pelvic floor, like doing your own research, like what is my pelvic floor? What is it supposed to do? And these are the things I kind of walk people through in their process with me is, and then like awareness, what can I get it to move? Can I get it to turn on? What does it feel like to do a squeeze? What does it feel like to relax that squeeze? Can I start to coordinate that? So can I do it, on my own? Can I do it that squeeze when I'm like squeeze and sneeze is a common thing that we say in pelvic floor physical. So I get that squeeze. Can I coordinate that with my sneezing or with cough or the heavy part of the lift in the gym? Can I recruit my pelvic floor when I need it? And then building strength, building endurance, getting that again, that closure to match whatever that pressure is. And then from there, just continue to work on strength. I think strength in general is really positive for your pelvic floor too. I always like some people will say like a strong body is a strong pelvic floor. So doing the strength training will also be very helpful for your pelvic floor too.
Perfect. Yes. And key takeaways like try and find someone, even if it's only for one assessment, to know what it is that you're dealing with. It's so huge. And that's what like I wasn't sure when I walked in with you what we were going to do. And we've had a number of follow-ups, which has been great. Something I also want to touch on because I think it's something that is often overlooked or just like assumed that it can't be improved upon. Diastasis as well as like the coning loafing. Can you explain, because I'm not good at explaining what it is. Can you explain what it is and maybe some things that people can do in order to help improve that?
Yes, 100%. I love talking about this because again, it's a space where there's a lot of fear. There's a lot of on the internet from providers, like there's a lot of fear created around an ab separation or separated ab. Um, a lot of people imagine that their abs are like legitimately separated, and that it becomes a scary. Like if you think about your body, like, well, my abs are separated. Like that creates fear of movement, fear of coning, and all this. And I really try to steer people away from that avenue. So what happens, and it doesn't have to be a pregnancy or postpartum thing. That's probably the most common place we see it, but there are a lot of people, men, women who've never had kids and do heavy weight lifting, and they have some degree of ab separation. My toddler who has weak abs because he's only 2 years old, when he goes to do a sit-up, he has a little bit of ab separation. No one is, it's not abnormal. It's totally normal. If you see your tiny little baby on the floor and they're kind of wiggle and move around, you'll probably see a little ab separation. And it's just because their core is not strong enough yet. And it's getting there. It'll go away. But it's not as scary as I think the internet makes it sound. So that's like my number one point. But during pregnancy, our two rectus abdominis, our six-pack muscles, are connected by a pretty thin connective tissue called your linea alba. And during pregnancy, we need more space. So that linea alba stretches to create more room. And then our two rectus abdominis kind of travel further apart. 100% of women will have diastasis or separation. I hate that word. Take that back. Stretching of their abs by the third trimester. You will see some coning, some doming in the third trimester. 100% normal. I always want to like preface that for people when they're pregnant is you will notice this at some point in your pregnancy, and do not raise any red flags in your mind. That's just your body creating more space. And that's wonderful. But we think about postpartum. We want that to kind of come back together. And I always remind people like the biggest things that will cause like a prolonged ab separation are a lot of things that aren't in our control. It's your genetics, how stretchy you are as a person, how many babies you've had, how big your babies were compared to you, how tall you are, how many babies were in your pregnancy, all those things that are really out of our control. The one thing that is in our control that we can change is how strong our abs are. So being stronger in your abs is protective against like prolonged diastasis. And so that's really the big thing is we need to get your deeper core back on board. We need to get all your muscles working together again. Will your abs ever look perfectly together? Maybe not. Am I concerned about that? Absolutely not. You can still do all the things. It's just learning how to manage that outward pressure by using some of that deeper core. I always like to tell people I have a diastasis, I have a separation of my abs postpartum. It doesn't stop me from doing any of the things. I just, for a long time was a lot more intentional about how I'm doing it, retrained my core, and now I'm kind of back to moving and doing sit-ups and all those kind of stuff. And I don't have to be very intentional about like how I'm doing it because of the work I've done before. And that's my goal for my clients too, is retrain your core. That way you can get back to moving freely without concern.
Absolutely. And I think that that's one of the things that, like, also the permission to go backwards as far as intensity of a workout is something that a lot of people are going to have to hear because it's like, I'm gung ho, right? I'm a nutrition coach. But meanwhile, I should really be backing off and I can't even do a proper bird dog, as you've seen. But like, I can do toes to bar like a champ. So it's like, um, being cognizant and able to swallow your pride, watch yourself in the mirror, record yourself. I think that's a huge thing that you told me is like so helpful because I can see, for instance, and I know many of you are going to go turn around and do this. You're going to watch yourself in the mirror. You're going to record yourself doing a plank or like a toe tap or whatever. And you're going to see like what I saw. And it's going to be like you're super tight and strong. But the second you take pressure and you move pressure, it drops. Right. And it's like all of my abs go boom. And I was like, what is that? And that was you telling me like you give me the right wording, but like this was losing pressure and I needed to relearn how to activate that and keep it strong throughout the whole movement. So what was that I deal with? What is that called?
Yeah, so like when it comes to like maintaining pressure, the muscle we think about is your transverse abdominis. I always say
Yes.
it's like your corset. It is like when you see those people deadlifting 300 pounds, they have that weightlifting belt. That is their internal weightlifting belt, and that kind of helps maintain pressure. And pressure is what keeps. So it's like we always think about pressure as a negative thing, but it's positive too because that's what creates strength in our abdomen. Is we kind of create pressure against a strong abdominal wall, and then we have a really solid trunk to lift and bend and all those kinds of things with. So learning how to manage that pressure and keep everything, drawn in and locked in when you're doing something like that. Yes, exactly. That's what I'm working on is like
Yes.
maintain that pressure, use it to your benefit.
Oh my gosh, yes. So you guys, like take this from me as many of you are listening, I'm your coach, right? Don't be afraid to step back and learn how to do the basics properly. Because just getting through the movement, even though it might be hard, you might be not training as effectively as you want to be and not getting the result that you're expecting. And also just know everything's always improvable. I think that that's helpful
Yeah.
at any age, right? You've seen improvements at any age. Um, I
Mhm.
know I'm going to have a number of moms ask the mom pooch slash the mom fupa at the bottom. What do we do? What is it called? What's typically the issue?
Yeah. A lot of times, again, well, lots of things. But a lot of times we tend to be really strong in our superficial abs, our obliques, our rectus abdominis. But again, that deeper, that transverse abdominis, which is going to wrap around from your ribs and your pelvis in the back all the way through the front. And it's when it contracts, it draws in. So if we feel like we still look pregnant or we have like that mom belly, one thing I'm really working on is getting that transverse abdominis stronger again, building up its muscle tension, and that can one changes how you feel, how you move. changes the strength, because now we're kind of using all of our core, just instead of not just our like most superficial muscles. But two, as that muscle builds tension, gets stronger, it can give a little bit more of that like drawn in appearance of your belly, because it's working more. A lot of times I always say that this muscular transverse abdominis, it's finicky, it likes to turn off um in lots of scenarios, whether someone had like a back injury, back surgery, an abdominal surgery, pregnancy, it just is like, yeah, no, no thanks, I'm out of here. So we do have to be intentional about turning it back on, retraining it, and making sure we're not just relying on the strength of our other muscles.
Yes, and that's something too. Like, there's a difference between properly using pressure and bracing and sucking in. And with that lower belly, like that, there's so many things that could be attested. And if you're following a nutrition plan, you're walking plenty, doing strength training, continuing to work on like certain deep core practices is going to be extremely helpful. I love that. Okay, one of the biggest things that I was surprised about, which I kind of expected going into this with like a little bit of my training background, your biggest thing for me to start with was learning how to breathe properly. And there's a million different things that people do wrong when they breathe. But I think that something that's really helpful is understanding, like, watching yourself breathe. Again, record yourself, look in the mirror, and be honest with yourself. Like, are you breathing into your chest and your shoulders only? Are you breathing into your belly? Like, I know that I struggled, like, my lower belly wasn't moving at all. So, I don't know if there's some way you can kind of like capture breathing exercise and maybe give some good takeaways for people to kind of look for.
Yeah. The reason I get really gung ho on breathing is your pelvic floor should, one, a couple things. I get caught up on people being able to breathe through their belly, because if you can let your belly get bigger and grow and expand as you take that belly breath in, then you're able to turn off your core. You're able to let it relax so you can fill space. A lot of times we can't get our breath that low because we're in the state of like clenching our lower belly muscle. So I'm really trying to get people out of that state of clenching and learning how to breathe through your belly or breathe all the way down into your pelvis is a really great way to just like undo what we have taught. So if we can take that really deep belly breath, we have to turn our muscles off to let it stretch and expand. So that's kind of one my way of getting people out of that clenching state is you need to be able to relax and expand your belly. That being one of it. But the second part is your diaphragm and your pelvic floor should work together. So they're kind of like two ends of the like core canister. So when you take a breath in, your diaphragm should drop into your abdominal cavity. The abs then should relax and expand to create more space, and pelvic floor should drop and relax too. And then on your exhale, diaphragm kind of springs back up and pelvic floor and belly kind of come in a little bit. And when we're just sitting here breathing, it's very small. It's just like this little wave that happens. But then we can use that to our advantage when it comes to like picking up a really heavy deadlift. We can kind of do that on our exhale. That way our core and our pelvic floor know that, hey, on our exhale, that's our time to squeeze. And we can then just kind of help support what we want our core and our pelvic floor to do in times like that. To just kind of make that what should be a pretty like natural thing that we do. Sometimes we get caught up in chest breathing, and so we do have to kind of like relearn that and then use it to our advantage when we're doing things.
Yes. And something that I think I need to point out, and I'm sure you'll agree, because there's a lot of girls and ladies in here that are type A like me, like always hyperactive, right? And I think that that's so many of us that end up being the ab grippers or the chest breathers, because we're always holding on to so much stress. So if you're a type A, you may struggle with this more. I don't know if, do you have an opinion?
No, 100%. Like, I think it's a lot of people don't realize how much tension they're holding in their pelvic floor. Like, once you're a little bit cued into like, hey, what's my pelvic floor doing? You're a little bit aware of like, wow, I was really stressed out today. And I was just like half kegling all day. It's like, wait, why are they doing that? Same thing, some people hold a lot of stress in their shoulders. When they get stressed out, they get like neck ache. Same thing can be true in our pelvic floor. We tend to just kind of protectively brace ourselves in times of high emotional stress. So yes, if you tend to like know you're like a high stress person, those are the times I'm like, okay, learn how to breathe through your belly, learn how to lengthen and relax your pelvic floor. So again, we're spending our most of our day kind of at that first floor instead of all the way up at the third floor.
Oh my God, yeah. And I love the elevator thing too, because every time that I'm practicing, and you guys, I do this almost every morning. Like I lay on the floor and I take deep breaths and I make sure I'm moving my pelvic floor down because I like Kelly taught me, right? And then, acting almost as if like that pelvic floor is on that elevator and I feel my body like almost pulling it up. And before, what I would do when I was breathing, I was just like sucking it down. And that's not the right way. So I think if you can almost like practice on feeling what that would feel like is more the up and down instead of the up and like out and in, like go up and down instead. I think that's a huge piece that would be really helpful for people.
For sure. I think that, a lot of us, and I get this all the time. It's like, I don't know. Like when I think about Kegling, I don't know what my pelvic floor is doing. Like we've never had someone tell us if we're doing it right or wrong in many cases. So that's where I really get back to, we can kind of, based on what you're feeling, we can kind of figure out like, hey, I think you're doing it right or not. But when doing the internal pelvic floor assessment, I can really confirm like, yes, that is you turning on your pelvic floor versus that is you turning it off. That
Mhm.
way, when you're practicing at home, like, okay, yep, that's it, or no, that wasn't quite right.
Okay, I'm going to ask a question that's totally off the wall. I've never asked you before because I did try this before and it went terribly. Like Kegel balls, like those things you can stick in there and hold up. Like, what's your opinion? Because it did not work for me.
Like the weights that we're talking about. Yes. Okay. Um, I don't I don't use them pretty much at all. I don't know if I've ever actually recommended them because I think you can do that's really strengthening your pelvic floor. But again, we need our pelvic floor not only to be strong but coordinated. So a lot of times I'm doing more like, okay, let's learn how to use our pelvic floor in this heavy squat. And that's giving your pelvic floor strength just like it's giving your legs and whatnot. I never want someone to, and again, a lot of people do, so maybe not the only one. A lot of people go and they buy them because they're leaky. But then again, I come back to like, how do you know you have a weak pelvic floor? Because a lot of people,
Mhm.
don't. A lot of people have an overactive. So in the case of an overactive pelvic floor, now we are making it squeeze anymore. We can really kind of create more issues and kind of drive this pattern. So I always want to, if someone wants to use them, I always want to double check, confirm that actually we do need strength. Because it can kind of exacerbate things if we actually fall in the camp of, we need to learn how to relax.
Yes. Oh my God. I tell you what, it was like, oh, I'm going to walk through the store and these suckers are going to go ding, ding. Like, forget. And I'm just gonna keep going. But anyway, I know there's a number of people that have heard of them, and I figured, you know what, I'm just gonna ask because then people know.
Yes.
And you know me, I'm totally transparent. So
No, I think you're probably not alone in that because they get advertised, they'll show up on your Facebook and you're like, I don't know, maybe I need those.
yeah, right. Now that we talked about it, it'll be both on our Facebooks today.
Yes, exactly.
Okay. Oh, that was something else too. To just circle back around on because I think this is something that's really important to understand is I know the first time you asked me to squeeze my pelvic floor, I squeezed the heck out of my butt. And I think that that's something like, is there a way that somebody can cue themselves to realize that they're doing that wrong?
Yeah. Yeah, I always just have people like watch for that. Like well, two things. Like your pelvic floor not only encircles your urethra, but it encircles your vaginal opening and your anus. So that's all kind of wraps along those and creates closure. So you will feel some on the back half, like the backside of your pelvic floor. You will feel closure on your anus when you're doing a pelvic floor squeeze. Totally normal. But if you feel yourself like clenching your glutes and sometimes I feel like glutes, your inner thigh muscles is another one we tend to squeeze, and we tend to squeeze our pelvic floor. There's a positive and negative. Sometimes, those muscles should work together in a lot of the things that we do. However, I want to make sure that you know how to squeeze your pelvic floor in and of itself and not rely on kind of like overflow from those other muscles. So if if that's the only way you can get your pelvic floor to squeeze is if you also squeeze your butt, I'm like, great, fine. But then we start to tweeze that away. So if that's where you start, and then try to be like, okay, can I keep that, but can I let my butt relax, or can I let my adductors relax? So it's a normal thing, but I do want to make sure we can do both. We can do it with and we can do it without.
Yes. Okay. Because this is one of the big things, being transparent again. I know that like when I get super, super stressed, like when I was traveling this week, oh, like It was just like I could not use the restroom at all because my pelvic floor was always so tense that it wouldn't let anything roll. And I'm like, oh my God, I just need to get home. But I feel like that is normal, but it's common, but it's not normal, right? Like we should be able to control both separately. And it's something I'm continuing to work on myself. But I know a number of other people probably struggle with it too. And I know that digestive thing gets screwed up when people get stressed out. And that kind of falls in this realm too.
Yes, 100%. I love how you mentioned like common versus normal because that's another soapbox that I like to get on is all these things that are super common. You know, like all of our moms have told us, like, oh, your pelvic floor now will be the same. You'll never be able to jump on a trampoline again. This is just life after babies.
Hmm.
That is a common experience, but it's not normal. It's not normal to not be able to jump without peeing your pants. It's not normal to have to go to the bathroom once an hour. Like common, but not normal. And there are things we can do about it.
Yes. Oh, there's always things you can do to improve. I love that. I will tell you, horseback riding, trotting did not go well. There's something there with like the boom, boom. I was like, ooh, we're going to stop trotting now. I'm going to talk to Kelly about that. um, but yeah, I think that's obviously, I mean, I have a lot of horseback riding moms too, so they probably understand.
Yeah. Oh, for sure. It's a lot. And yeah, it's a lot of like impact, but yeah,
Yeah.
absolutely.
Yeah, it's just managing that squeeze. But I will say, ever since you taught me the whole like squeeze before you sneeze or cough, no problems. And like, I guess a quick touch on muscle memory, because it's not always like you're always going to have to be cognizant of these things. I think after you practice them enough, it becomes natural.
Yes, 100%. That is always my goal by the end. Is at first we are very, it's any skill you're learning. You're very intentional, you're very mindful. You have to be, your brain is working just as hard as your body is working. But then we want to build your strength, build your endurance, build your coordination so that way you can get back to moving without having to think about every little thing like, oh, do I need to squeeze my pelvic floor? We're teaching your pelvic floor what to do so then you can start moving with intensity, speed, and you don't have to stop and think about, oh, should I squeeze or should I not squeeze, because your pelvic floor knows what to do. We don't have to think about it anymore. So it's 100% the goal of mine is to get it where you can move without limits, without having to think about it, without having to be like super in your head about what am I feeling. That's where we start because that's how we learn. But then yes, I want to get people to where they can just like go for a run. They're not thinking about like, what's my pelvic floor doing?
Exactly. Exactly. You have been absolutely amazing. I'm so glad we did this. I guess before we go, the last thing I always kind of love to throw in there, which I'm sure you can expect, is if there's anything you can tell people struggling with this, struggling with anything else as a mom or as a PT, what's your piece of advice to give today?
Yeah. I would definitely like don't feel like you are who you are. Like you these all these things can be changeable. You just even if you've had, multiple babies or whatever, know that things can get better and there are people out here that can help you. And again, there are hopefully in your area lots of different options. Find the person that fits you. Um, it does take work. Like you do have to change a lot of things that have been very um like just these habits that we created. So it is hard. But I think it pays off in spades at the end. And I they don't meet very many people that aren't happy that they did it by the time that they're done. Because I think it, even just knowing a little bit more about your body, about yourself is really positive and then can create a lot of positive changes.
I love it. Thank you so much, Kelly, for being here.
Thanks for having
Awesome.
me. This was really fun. I was nervous coming into it, but this was awesome.
No, it's going to be great. And if you guys want to get a hold of Kelly, I reached out to her, I think, through Instagram the first time, or on her website, you can book a call or book an appointment. So you can reach out to her if you're in the area and be awesome.
Yes, absolutely. Thank you.
All right. Well, we'll talk to you later.
Sounds good. Bye.
Bye.